Stem cells possess remarkable regenerative potential, offering transformative benefits in healthcare. But there's another type of cell that's easier to obtain from the body, can act like stem cells do with regenerative properties, and be guided to specific areas of the body. Our guest today is a board certified emergency medicine physician and is on a mission to help her clients optimize their health through precision medicine, utilizing a cutting edge approach to tissue repair and anti aging effects at her medical center, the Biohack Lab. This is the story of VSEL therapy with Dr. Sienna Steckel. Dr. Sienna, great to see you again.
Hi, thank you for
And I know I threw in the V cell as kind of the topic here, but as we know when we started this discussion before we start taping right now, I feel like we have a lot to talk about in medicine. But I want to start with this idea of originating in the conventional world in the emergency, ward of a hospital and then moving into integrative. So can you tell us that story of kind of what made you leave the conventional model behind?
Well, it starts with what got me into medicine in the first place.
Yeah.
I was very angry at doctors. In fact, I used to say I hated doctors. And so I thought that they misdiagnosed my mom and put things off. And we did some alternative therapies for her illness. And so I figured I want to do preventative stuff. And so the only way that people would listen to me is if I had an MD behind my name. So I got into it with a negative energy, but a very passionate desire to learn. I didn't know other doctors. I grew up in a little small town. I had one doctor as a pediatrician. I didn't even know there's the consortment. There wasn't anyone in my family. I didn't know that the training regimen. And so I got swept up in the whole process. And as I was going through different fields of something to fit into, emergency medicine just fit my personality. Which surprised me because I thought I was a little bit more of a control freak. And I realized, and I thought emergency would be all about chaos. Totally not about chaos. The quietest room should be a room that is having a cardiac resuscitation or trauma. It should be the quietest room. There's a rhythm and a dance, and everyone has a role, and it's a team. And so that fit very much what I like to do. And after a while, though, and at the time, it was not as regulated. We are here to take whatever comes to the door, and it's a matter of what can we do, how can we do it, and utilizing the resources that we had. That had evolved and changed over the 20 years since first stepping into it, and the 15 years of being out in practice. And I was wondering why I was not so happy, and borderline miserable and depressed. And it evolved into multiple things, personal reasons of me even saying I hated doctors, and I am one, so I'm sure I was carrying that energetic, like, that's actually quite real. And realized that innately, I think I was more drawn to what got me into medicine, which was more of this regenerative, preventative kind of alternative modalities. And here I was doing things that was now, you have to have this protocol. You have to see a patient within 15 minutes. You have to have an order in with certain time, whether it was needed or not.
Mm-hmm.
And the revolving door of we're not really making much of an impact. Yes, there are some amazing interventions and amazing wins. And, it's that kind of that carrot that keeps you going back because you had an amazing case or an amazing save or you made an impact. But it was becoming it was not the norm anymore. And we are being used as primary care doctors, which there's no capacity to do that because you weren't making a change in their life to the way that I wanted to. So I was so wrapped up in that being my complete life. Like I did the job of two docs in a month than a full-time one doc. And basically there's a lack of balance. So another lesson I had a lot of lessons in this. And I did multiple dives, first finding why am I so unhappy? And if I'm not doing an emergency, since I don't have a resume to do anything else, what else can I do? And the world opened up and I found complete 180 or complete 360 back to embracing a lot of what I was introduced to as a child when my mom was sick, that there's so many other things out there that really can move the needle. and are energetically just aligned and soft and with the body and not fighting the body. And after doing those deep dives, one of the modalities that I got introduced to that's pretty powerful are the VSELs,
Mm,
and a whole slew of other stuff.
yeah.
But so that's a long story.
Well, it's a story that I've heard. I don't think it's a common story, but I think it's common from those in the integrative field. It's the story I told you, very similar to my father's, starting off in the hospital and feeling disappointed, not being able to do enough and traveling the world afterwards. But I have to ask, why don't you feel like more doctors? Because I think as a whole, doctors are a little bit burned out, that we know. They're a little bit at this, hey, like jaded, like I got into it for this and I'm doing this, right? And I'm not really helping move the needle, as you said. Why don't you feel more doctors are stepping out into that same realm of what you kind of went?
I think there's a lot of reasons.
Yeah.
Uh, One, I don't think we ask the question of why did I get into medicine in the first place? We fill out that answer on our intake forms and stuff. It sounds all eloquent. Oh, I want to make a difference in the world. I want to do this. But I don't think we know ourselves enough at the age of 18 and 21 when we're in it to be able to answer that question truly.
Hmm.
And then you get wrapped up in survival mode. You spend so much time training, then you get out and you've got all these debts, and then you dive in and you build this practice, and it becomes what you know. And unless you're exposed to other ways of doing things, you might get burned out, but you don't even know why you're burned out for real. And it's not just the hours, it's not pay. It's because there's no foundation and there's a level of expectation that can't be met by, there's a lot of different reasons of why we even have burnout. And I think the definition of what burnout truly is has been miscued, and we can go on that in a whole nother podcast. So, but even those that have been exposed to maybe ways of doing things differently, there's a lot of fear around change for anybody. But if your identities and your degree and your whole financial stability has been wrapped up in how you've been doing your practice, and then you want to try to do something new, you have to let go of the identity that got you there, explain to your client, your patients, that things are going to be different. And they're like, okay, but you've been telling me this for 15 years. Now you're telling me something completely different. Were you lying to me there, or what happened there? And why are you doing something now? So you have to have a huge ability to be humble and not have, and let put your ego at the door. And that's hard for anyone, let alone somebody who's been, in survival. And training has kind of softened, almost unfortunately softened too much through the years. Um, and then there's the fear about, in this culture anyways, we have a big target on we being the MDs or DOs, target on our back that can be for litigation. FDA can take away our license, or medical boards can take away our license, just because it's easier than acknowledging that these things may be very beneficial. So there's fear from all avenues. And it's more comfortable to stay in something we know than to step out into the unknown for anything, actually.
Yeah. Yeah.
That-
And we're
it's-
we're we're so deep into this field that, we think it's somewhat maybe not normal or anything, but it's something that anyone could do, I think, and say, like, why can't a doctor just do this? And it's not. I mean, you are a pioneer. What we're doing is kind of pioneering. It's still attacked a lot. It's still seen as woo woo and these other things. And most patients or people don't even quite understand it at all. Even when you try and tell them in simple terms that, wouldn't you want to go after the why of why you're sick instead of just masking it and managing and even that is kind of like a puzzling look you get from most. So it's, when you're this deep into it and looking at it from the inside out, it looks a little bit different than what it looks like for a doctor. So I can appreciate that. And I do think that anyone that's able to make that leap of faith, is truly it's a courageous act.
it's scary.
Yeah,
And, but it's exciting.
it is.
Because there's really no other way. well, at least for me,
Hmm.
to continue doing what I wanted to do if I'm not really believing in what I can provide. And that mismatch of doing something, even though I know it's really not going to help them,
Yep.
I personally couldn't. I did it for many years, and we can stuff that for a long time, and
Yep.
you know, numb it or work it out, or that's what I would do. The gym was very helpful, um, but there's only so long that I personally could be in that dichotomy. And another big piece is the medical model. It's not broken. It's beautifully made for what it was designed for.
Mm,
And the doctors that go through that training, I didn't even know. I thought I was doing exactly what I was supposed to do because that's what the book says. That's what my attending said. That's how I've been practicing. And why would I not do that? And sometimes it's because you don't see results. If you're in the ER, you don't even necessarily know because unless they come back, you don't know down the road,
yeah.
uh, unless you keep charts open like I did for a while to see what happens.
Hmm.
But um, unless you have that broader scope, you're doing what you were trained because that was the model and that was the way things are done. And it's perfectly and beautifully made for what it was designed for. But it wasn't designed for healing
Hmm.
and and a whole nother way of root cause. What does that mean? And so it's a dialogue and a way, just a different paradigm of looking at what does one really want from their visit, let's say, to a doctor.
Right.
Just be on more pills, and do you want a diagnosis, or do you want to find a way of feeling amazing? And so it's just it's a different discussion because it's a different way of defining things.
Well, I think it's not an either or. It's not that you have to go towards one approach only. Again, if you're in an accident, you're going to end up at a hospital, right? And you're going to be very appreciative when they put you back together there in that acute state. If you end up with chronic disease, maybe that's a different conversation. And that's where another paradigm comes into play. And as you mentioned, it's an exciting paradigm because your toolkit expands exponentially, right? The blinders are off from surgery, pills, surgery to a lot of different things, including what we talked about here, which are V cells. Now, for the audience, can you go into what VSEL stands for and what they are?
Sure, sure. So we're talking about stem cells, and the acronym VSEL stands for very small embryonic like.
Yep.
So if we break that apart, first of all, stem cells are our regenerative cells of our body. We wouldn't be alive if we didn't have stem cells. We are constantly turning over cells every single second, every single minute. Every organ has a different, or cell line has a different lifespan, but we're constantly turning things over because we're living. And those need to then bring in more information. So more stem cells are going to support the regeneration of that tissue, but all the way until we no longer are on this earth. And there's different stages of those cells. Some of them are like, I'm only going to be a neuron. I'm only going to be a heart muscle. I'm only going to be this. And if you backtrack that to the very beginning, like an embryo, they're like, I can be anything, right? So embryonic like means we're gone all the way back as close to that I can be anything type of cell without being truly anything as far as
Right.
none of these are going to turn into cancer. None of these are going to turn into little babies in your body,
Hmm.
but they have the potential to turn into or to give the information to that part of your body to create more of that cell type. So if they go to your brain, or they go to your heart, or they go to your ovaries, they say, okay, I see you here. I can give you information. We can make more of you, wherever that may
Hmm.
be. And so the embryonic like is the one with the largest potential that we would use. The very small part means they're tiny in nanometers, tiny, like 1 to 4 nanometers, which means they can go anywhere. The larger stem cells, the ones that have kind of been growing for a little while, less potential, they're bigger. And so if we were to put them back in your vein and want them to flow around, they can only go to certain spots because they're going to get hung up, particularly in your lungs, because
Mm.
the capillaries and the parenchyma are just too small. So they're going to go there and they're like, okay, I'm here. I can't go anywhere else. So that's the idea is we have very young, so very a lot of potential, and very small, we can go anywhere, stem cells. The beautiful part about these is they are your own. So you don't have to source them from another embryonic tissue, Wharton's jelly, umbilical cords, things like that. They're your own. So they know you. And there's no way of having any adverse allergic type reactions or responses. And they are living dormant since about the first day, first year of life, which is why they still carry that embryonic like potential. And they're dormant, meaning they're sleeping attached to a protein in your bone marrow, then floating around, waiting for that signal to say, okay, here I am, I'm going to go to work. Why we have this backup system, which we just kind of found, I don't know. Who knows? We can speculate on that for as long as we want. But we do, and there's a few signals that can turn them on. We found like maybe an extreme heart attack or extreme cold, not just a cryo plunge, but like
Mm.
cryopreparation type of cold. And then we found, or not we, but some brilliant minds, Dr. Todd and his colleagues, have found a specific frequency, which, if you believe, like I do, that everything is frequency, um, that that resonates with the stem cell connected to the protein. So when exposed to this frequency, they become activated. So we can talk about what we do with these, but the idea is you have them from when you're 5 until you're 90, and if we activate them, they're going to be just as potent. And we get them from your blood, and we can talk about more what we do with them. But that's what B cells are.
Yeah, no, it's very fascinating because we'll get into this in a second. It's an easy process to extract these cells, right? And it's very much, a lot of people know PRP and extracting, running it through centrifuge and kind of getting down. So can you take us through that, what the process would be like of actually getting those V cells and then using them for therapy?
So, like I said, they're floating around in your blood or in your bone marrow. Well, stem cells basically come from your bone marrow. There's a few that come directly from other tissues, but I do certain other processes that to kind of encourage more stem cells to come into circulation. But once they're in your blood, we literally just do a blood draw. So you don't have to harvest them from your hip where you get some
Hmm.
mesenchymal cells or your fat tissue and spin them down. This is a simple blood draw. And like you mentioned, the way that we kind of separate out, well, the B cells should be in the plasma, not the red cells. So we spin it down like PRP to kind of clear out the tissues that we don't want. And we take that fragment. Again, all you have is an IV in your arm. And then we activate them with a specific type of light or frequency because it's not within the visual spectrum. Um, and we have some time that we now have a PRP fragment with all its growth factors and all the lovely juices of plasma and activated stem cells. And then we can reinfuse them into your IV, again, painless.
Hmm.
And I can tell you how we get them to go where, if you want, where we guide them to where we want them to go. And that's the extent of getting them from your body and putting them in. Now, granted, we can also inject them into joints, do facials, do all the other things that you can do with other forms of stem cells and exosomes and PRP. Uh, to me, it's like PRP on steroids or some
Yeah.
cut little because you have all of that regenerative properties plus stem cells and exosomes because exosomes are in PRP and they're the product of stem cells. So it's like a golden mixture.
Well, like you said, it is PRP a little bit on steroids, but it's also precision kind of PRP with stem cells, even more regenerative. And I found it really interesting also because, when you do PRP, platelets also are kind of these signalers too, to where to go in a sense. But then you can even go further with the V cells as to where you want to apply them. And in medicine, that's one of the toughest things. Even
Yeah.
I remember on the panel, Zach was there from Austin Biotech and saying, we throw the stem cells in there and they go through the, real process into the hip, procedural sort of, pulling it out of the bone marrow, painful somewhat. But, they're using it for fertility. But how do you absolutely know they're going to the ovaries when you do the systemic, kind of
Right.
approach to it. And that's where I found it really interesting with the V cell therapy, because you're using, again, you give them that frequency and then they look and then you apply that frequency correct to where you want it. So go into that a little bit about how you're being so precise of where these V cells are going.
Exactly. So during the infusion, when we put it back into your arm and we are pushing it through, we have about 25, science is still out there, but the studies are showing we have about 25 minutes, 30 minutes max of telling those stem cells where to go. Because stem cells, by definition, again, are regenerative. So if you, my example I always give, if you stubbed your toe that morning and I gave you stem cells, they're like, oh, signal, you have pain there. I need to go there and fix your toe. But I'm like, no, you've got some dementia, you got some heart failure. I want you to come over here. And so how we guide them is, again, that frequency, that uh, specific wavelength, that stem cell already recognized and it carries that signature. And so when we take that same, it looks like a laser, and point it onto the part of the body that we want them to go, they recognize it and they are drawn to it, just like a chick to its mother or a homing device. And so if I put it on your brain right there in the substantia nigra, if you have Parkinson's disease, they will go there. And as stem cells do, they'll create their cell adhesions, and it's like stickiness, and they stay there. And then that regenerative process and signal goes on for weeks to months. And so it's now it's there. Exosomes will go and they have the juiciness, but they don't have the capacity to stay.
Mm.
And so we can do that for your shine on your heart. We can do that on your gonads. So if your testes or your ovaries, it's a different way than Zach would do. And the reason we believe and the reason we know that they go where we want them to go is one, by clinical outcome. But the other is the example like I like to give, which is very visual. And if you've ever done any science and you have a petri dish and you know that to know where something is, you tag it. So they took the B cells that they had just activated and they painted it across to this agar. And they took the laser and they set it down and it would shine a light across or would shine across the agar. They left, they came back, and then they gave whatever they needed to give to highlight where that tagged cell was. They basically lit it up. And those stem cells were in perfect line where laser was. They literally had migrated across the agar because they were attracted to it. And that's what they stayed. And that's an agar. That's a outside the body way of looking at where they go, but it gives you an idea that they are attracted and they are recognized by that frequency. So that allows us now, because they're so small and they can cross the blood-brain barrier, we can address neurologic conditions, visual issues, returning around heart failure, and they in a 3D form, we can tell them where to go. And that excites me to no end, because it's a painless way to address stuff that we've never been able to move the needle on before.
Yeah. And it's just, frequency in a way, of course, energy, information. So if you're providing that information, you're basically saying, hey, come here. You're ringing that bell and everything. And they follow that information, which is in a frequency pattern. Now, one of the things that I know in PRP is common sometimes is the ability to count how many platelets you're providing, platelet counter or something. Is there a way to do that with V cells where you know how many V cells are being injected?
I've caught wind that there is technology and there's some people out there that are trying to do this. And so I know
Yeah.
that you can, because that's how the studies were done initially.
Yeah.
At the bedside right now, we don't have that, but it's coming.
Yeah.
So we go by what we assume is an average of how many billions of stem cells, we have in a typical infusion, which is about 70 cc's. Apart from the research, we can't quantify it in real time yet, though I know the technology is out there, and pretty soon it is going to be something that I'm going to be applying so that we know. Because even though we know or that they don't age and we have plenty, we also know that one's capacity, their bone marrow in general, decreases with age. And so you would have to think that the volume eventually would also be affected of the volume of potential stem cells.
Mhm.
Now, we the potency and the virulence of them are going to be the same if they are V cells, but maybe the capacity or the volume that we have may vary from a 6'5",
Sure.
250 person and a little 4.2, 4 foot person. Maybe not. And so I do know that the technology is out there. Ideally, it would be something practitioners will be able to have at the bedside to quantify. Okay, maybe I need a few more tubes,
Yeah.
or maybe, yeah. So this is very new, and maybe I don't even know all the new stuff that's out there for sure. But it's exciting that we do understand that there's a certain number that we are getting good effects,
hmm
and the possibility of being able to even quantify and do more research is in active practice.
Is there a protocol you're placing patients on to just improve the therapy as a whole? Let's say, again, going to PRP, you could put them on papaya seed extract, try and increase the number of platelets, certain dietary things you could go for and just maximize the effect of the therapy. Is there anything you're utilizing with patients?
I am, and this is a moving target as we are, or as I am finding what works the best, and everyone's a little bit different based on what their goals are. But one of the reasons I love working at the Biohack Lab, because it brings in all those other modalities that I like. So before, um, ideally, if somebody's inflamed or a, the voltage isn't quite on, we do things initially. So we do some hyperbaric or some CVAC, some PEMF, some red light. We start them on some stem cell activators. Like I'm really a good fan of stem regen.
Mm,
Uh, getting more in circulation. And if somebody even needs a little, depending on what our target is or our outcome, they may even need a little bit of that before. Uh, Ideally, also, they're not exposing themselves to other toxins and viruses and stuff around the procedure because you don't want those stem cells confused and trying to clean up shop. Now, granted, we're bringing them to one place, but after that, we want the rest of them to go to those signals as well and not just try to help the SIBO you have going on in your gut or some other
mm,
um, cold that you just picked up. And then I also add peptides and IVs during or the day before. Some of them are clearing up senolytic cells so that your body doesn't have to deal with that. It's basically taking out the trash. You have a clean
mhm,
slate. Afterwards, I'm also a very strong proponent is just these V cells are never in isolation or anything in isolation is going to be effective. You're giving them information.
mm,
Now you got to say, what do you want to do with it?
mm,
So I can inject it or I can direct it in one place. But if let's say your brain, but if you don't then activate that area, they're just going to be sitting there going, okay, I'm here. You're not
Yeah.
telling them to wake up and to grow stuff. So you stimulate that area. And so whether that is with neurofeedback, whether that is with games, whether that's coordination, it all depends on what the goals are. If in the brain, if it's visual, you want them to look at things, you want them to track things, you want them to look at some depth perception or whatever the goal is. So now that the information's there, let's put it to use and really, and so with that, I always like afterwards also more hyperbaric or CVAC,
mm,
more peptides, more PMF, all those things that are going to help the cells not clump, help get the signal there, the voltage there. Basically, you've got little babies. Now we have to educate them and train them and protect them and get them to really do what they want to do. So those are the bigger class of things, but it is somewhat in a protocol depending on what their goal is at the time.
Let's talk results. Everyone wants to hear about results. Do you have any notable cases that kind of stick out to you? And of course, I understand at the Biohack Lab, like, a lot of integrated places, you're not just utilizing one therapy alone, and there is a synergy to it. But is there anything that kind of sticks out to you when applying the V cell therapy that, hey, here's what we saw in these types of cases?
The two that I'm most excited about actually didn't get much use of all the other modalities at the time.
Mm,
It couldn't, or it didn't exist, or they don't actually live here. And so they
right.
came to the thing and had to leave. And that was around the heart. Neurologic ones, we've seen some results, but they take more time and they can be very nuanced.
hmm
Mm, And I have some harder cases. So, but there's some a lot, but two that are just very subjective and easy are around heart patients. And one, I love this story because I forced her to come see me. She's a colleague of mine. And if you think I work hard, she has even more stress on her. And unfortunately went through the typical medical model and for her hyperthyroidism and a few other things. And so because of the way it happened, she ended up with heart failure
Mm.
and at a young age, and they almost transplant level heart failure. And she's still teaching and in the ER and supporting her family and had some other metabolic things that weren't in her favor. And she really wanted surgery for something. Not that I agreed with it and didn't want it, but they wouldn't clear her because of her heart.
Mm.
She finally was motivated enough to come see me because I was begging her to come before that. And so she finally did because she had an ulterior motive. And one session with VSELs, primarily to her heart, and I get a text from her. Now, granted, I'm the one blowing up her phone before, and she volunteers a text to me. She goes, "When's our next session? Our next VSEL session?" I'm like, "It's been a month. Okay, when you want, might be a little early." And before I can even get the text out, she sends me a follow-up text of a repeat echo of her heart. And she was about 20% before. She had gone up to 45%. So that means that the heart is able to pump more. And I'm like, "Why did you get an echo so soon? It's been a month." She goes, "Well, my doctor was noticing I wasn't swelling as much and I wasn't wheezing." And he's like, "Well, let's just get an echo."
Mm.
And the sad part is they cleared her for surgery. She had the surgery. She had a bad outcome from the surgery. So
Mm.
now, but I did give her the second one before, and so she probably would have died otherwise, but she almost did.
Wow.
Um, but the idea that even within a month, and she didn't do much of anything else, a couple other things, her capacity was enormous. She was walking around now. She was breathing comfortably. She wasn't swelling, and her heart was remarkably better. I also did a little bit of her knee just for like a couple seconds, and she's like,
Mm.
"That you did with my," and I didn't inject it, which normally I would. She goes, "That thing you did with my knee, I don't have any pain anymore." She goes, "Why is that?" So that's one. The other one was another heart failure where he would be so tired just washing his hair because the amount of effort, and
Yeah.
there's a lot actually with blood having to go up versus,
Hmm.
and and he would get winded just from a shower. And after one treatment, within even less than a week, his family are having to stop him from overexerting himself walking through the mall.
Wow.
He doesn't get tired when he showers anymore. And because he wants to go, 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 he's not going to, know his own.
Hmm.
The only thing that limits us now is his knee pain. So when am I going to come and do something? Because I really want to focus on his heart.
Hmm.
I don't have a repeat echo on him yet. I keep telling him to, but that's out of my control. But uh, clinically, he's like a new person. So those are two that have been profound within less than a month type of results. And not everybody gets results that fast. It depends
Yeah.
on either how much kind of we need to work with. Um, but because people will still end up getting results months later. But
Yep.
those are two pretty profound ones.
And are there any types of patients dealing with different diagnoses and conditions that should avoid a V cell therapy?
I don't think so.
Mm.
And that's a conversation. The biggest conversation around that is cancer.
Yeah. Big C word.
And yeah, that big C word. And this is a whole nother podcast, but I think there's a
Yeah.
lot of and there's a lot of different theories of what truly causes cancer and what cancer is. And if we don't know quite what that is, if it's not as clear cut as like I was trained and retrained, it then goes, well, how do we treat something if we don't really? I still think that there's a broader conversation of what cancer is.
Hmm.
So we are afraid that if we are giving regenerative modalities to the body, that we're also getting regenerative things to cancer.
Yeah.
Meaning if I provide something that's going to improve something in your body, is it also going to improve cancer, make cancer worse? I'm of the thought that no, if I think cancer is a imbalance for whatever that imbalance may be, and that's another uh, rabbit hole.
Hmm.
But I feel if you're strengthening your immune system and your cellular capacity, it has the resilience to deal with that imbalance, which we will call cancer. And there are some places that actually use stem cells of different modalities for cancer therapies.
Mhm.
There's, and so it's a conversation with the patient and the patient's oncologist or whoever. Um, but in general, I don't think there's any condition or individual or something that would either be restricted from it or wouldn't benefit from it.
Well, the beauty of it is you're utilizing something that's already in the body.
Yeah.
It's you're not introducing anything new.
Mhm.
You're not trying to, get a kind of biochemical reaction by adding chemicals or anything like that. So it is one of the most natural forms of therapy you could think of. This is just activating our innate healing abilities.
Innate
And
intelligence.
that's why I believe it's not really looked at in a way, let's say, as stem cells are, especially by the FDA and medical boards. You're not adding anything new to the body. You're just taking it out, just using it and putting it back in.
Yep.
So
Yep. And beautifully said, because that's one reason why the FDA, it is so safe. And we are, I love that you commented on that because that's what I feel. I feel it's a very sanctuous, energetically aligned. We're just tapping into your own intelligence, maybe giving it a little boost to say, hey, this little area over here needs some of your love, needs some of your information, needs some of your it's been bombarded a little bit or it's been misguided. Maybe you can come put it back on board. Uh, and that's it. And the other modalities are really just to support what our bodies are naturally able to do when we get out of the way. And
yeah.
this is another, we're just coaxing it or encouraging it to do what it's naturally meant to do. And that's why I got behind it. And I keep using it because it can't hurt at all
Hmm.
uh, as far as causing any reaction or damage. And yeah, so
What other therapies are you utilizing at the Biohack Lab that you're excited about beyond VSEL, maybe combinations? And of course, everyone's individual and there's personalization to this, but overall patterns do you see that are really, really impacting people?
wow, so many.
Mm,
Well, anything that gets our nervous system regulated, and that's a kind
mm,
of term, but calms this constant state of fight or flight. And we don't
mhm.
even realize we're in it because you're like, oh, I don't feel stressed. Well, your body's feeling it underneath. And we don't have to be jittery or angry to be feeling that. And that's one of the number one things I try to do before even B cells. Because if you are, for any reason, in that, we'll say blocked, clamped, fight or flight, sympathetic
Yeah.
tone, they're not going to go there and do what they need to do.
Yeah.
And that's even the beginning part of all of my treatments are right there on your vagus nerve. That's where
Hmm.
I put all the energy and all the treatments before. And that's why we're trying. So the lab here, I joke that I want to get a metal worker or somebody to create the chemical structure of oxytocin and put it on the wall. It feels like they got a warm hug when they walk out of this
Hmm.
and everyone feels better. And the other modalities help. I mean, it might be the sauna, it might have been the red light, the PMF, but it's ultimately because their systems went down, their shoulders went down,
Yeah.
they breathed, and anything, anything is possible in that state. And we don't realize that we aren't in that state 99% of the time.
No, no.
And that's because that to me, that's a cause of dis-ease. And there are a lot of other, I mean, there's a lot of tricks out there that, or I don't even say tricks, there's modalities that help get us into that mode. But it's not, this is where I have some issues maybe with the biohack community, where if it's another thing on our list to do, even if it's a good thing, but it's like you go and you meditate for 15 minutes, but then you get right back on and you have road rage or you start yelling. I mean,
Right.
you know, am
Yeah.
I? How about, is it really doing what we wanted it to do? Yes, you did it and it was great. And you had your little aha, maybe,
Yeah.
even breath work, but it goes back to that question of why, right? Why we,
Mm-hmm.
so I love IV ozone or different
Mm-hmm.
modalities of ozone. I love frequency modalities, whether it's magnetic or whether it's pulsed electro uh, PEMFs or PMAs, PMIs, whether it's voltage related or pressure related with hyperbarics or the CVAC. And I mean, there's all these other amazing things that help turn on the cells. They help with things across the membrane. They help with circulation and lymph flow. These are all good things for the body. And I love all of them. And I'm passionate about so many of them and light therapies, so all different things of frequency. Um, but the number one thing that will move the needle is if the individual believes that they are worthy of receiving
Mm-hmm.
and worthy, or not even worthy like they've earned it, but they own that they are whole as they are. And
Yes.
that's miraculous healing.
Yeah.
Miraculous, but it's truly what it is. Neurofeedback is a fantastic way, and we've been diving into that, and that's a whole training. But all of that is doing is unloading these levels of belief systems and things that keep us like this.
Yes.
And we have no idea why, because we didn't take the time to sit back and say, why am I doing X, Y, and Z? Why am I feeling this way? Why am I acting this way? Why am I, the why? So I know that's not quite the question you asked, but it goes into why I like all these modalities, but ultimately all these modalities come back to that's the reason I use them.
Yeah. And I've always said that these modalities are catalysts of what happens in nature, what happens when a healthy organism, that's what they do. They're not meant to push you too far, do anything. They're just reenacting basically what our body already does and has lost that ability to because of, dysregulation, as you mentioned, root causes, toxicity, whatever it may be. But you're very correct in this idea that if you don't have the foundations of why, if you don't have the foundations of getting out of lower consciousness states, all of these catalysts don't mean as much. They won't work as well. And that's where I do believe a lot of people get hung up because at these biohacker conferences, as many conferences, you're going to have a mix of attendees. I go there trying to network and do everything. My why is to, broaden to meet people such as yourself. But a lot of people's why they go there is because they're dealing with something. I remember being in the front row. I believe it was your talk and Zach's, and there was a woman there just asking questions. You could tell it was about her. She had some injury or something. This happened, and she would just tell me more about this. Tell me, and everyone was like, afterwards, let's meet because this is kind of like a patient consult now. And you have a lot of those people, and they go from conference to conference to conference, asking and looking for that one silver bullet, when a lot of times they're not really going within and saying, what is within me that's blocking these wonderful therapies from working? Because then you go, it didn't work, it didn't work. And nothing works because you're not in the state for it to work. Am I
You're looking
right?
100%. You're looking
Yeah.
outside of yourself for an answer or an explanation or a treatment or something to fix you.
Yeah.
So you think that you're broken. You've identified with this disease or this state. And so what I commonly hear or see people, they've gone to 20 different doctors. They've done all these extraordinary treatments. They've gone to Europe. They've gone to Mexico. And they've done some things that I think are amazing. They've done the plasmapheresis and they've done these
Mm,
cleanses. I mean, some amazing things. And why am I still not getting any better? Still
yes.
waiting for that aha doctor or that aha treatment. And it's never outside of ourselves. And until they say, or they ask themselves, how is this serving me? What about this is still here, or what have I not addressed that this is here because it is, and I know a lot of people are not going to want to hear this. Um, it's going to make a lot of people cringe and hopefully not maybe keep watching your podcast. I apologize. You can cut this out.
No, go.
But this disease, this condition, I believe, is there because it's still serving us in some way.
Yeah.
And even if it's pain, we call it painful, we tell everybody we don't want it, and we go, years and all these specialists, and we keep saying that we don't want this, we want to be different.
Mhm.
Um, my belief is part of you may think that that's what you want because that's what is expected, or you think that would be the right way to be, but it's still there because either we haven't wanted to address something
Mhm.
or it's still serving us in some capacity. And most of the time, we don't know that. We don't know what that capacity is because we haven't asked the question. And um, I know I went on a tangent there, but it's again looking for things outside of ourselves, and not asking the right question.
Yeah.
Um,
I agree with you 100%. And I know that ruffles feathers when you say, what do you mean? I want this disease? I needed this disease? But the truth of the matter is, most people that have struggled with it and come out the other side will look back and say it was a blessing. I needed that transformation. I needed that kick in the butt from this disease that was horrible going through it, that really took years away from me, but also gave me a whole new appreciation. Again, I think disease, you shouldn't even look at disease. You should look at the healing process as very transformative for your highest good. And when you go through a true healing process, and I say this, it's not easy. It's not taking a pill and continuing what you always did. It's not masking. It's not a surgery and continuing the way you were. It's going into the depths of your soul to try and figure out what is needed of me to change to truly heal. And that's
Transmutation.
never easy. I'm sure you see this a lot. Like patients come in, they get VSEL, they get ozone, they get all these remarkable things, but they won't address a trauma or a poor relationship with their sibling or something there and say, no, no, you got me better, doc. I'm great. I feel good. But that's still there.
A
And
year,
then sooner or later, they will return because they didn't address the thing. And of course, we're not just body, we're mind, we're spirit, we are relationship, we're all these things. So the fact that so many people, I think they just have to understand healing is going to be a long journey. We are always healing forever, really, in a sense, but especially healing from a chronic disease is not easy, and it's there to teach you a lesson. So it's almost be open to that, be open to the lesson, whatever it may come.
yeah. And even though it may not be, it may be something that is viewed as long term, like not easy. I think that opening up the possibility that it can be easy and it can be simple allows that breath that it's not overwhelming, that we don't need to be, doesn't need to be chronic. It's only chronic because we keep holding on to it or we haven't addressed it. Um, it opens the possibility, and things can happen pretty quickly
Oh
if
yeah.
that was the nature of what is the plan for that individual. And it's also just how open or ready or how much wanting that individual is for true transformation. And just like whether it's, somebody could say, oh, it's not just I'm holding on to this trauma or I'm not forgiving this person. That's a big piece of it. But also maybe why am I still staying in the type of environmental exposures that I am? So
Mm,
why, if we want to even just go back to grass stuff that somebody doesn't want to dive into the yes, quote unquote esoteric just because we haven't put it into our normal vernacular yet, and saying, okay, why are you still listening to this? Why are you still eating these kinds of things? Why are you still having this routine? Why are you still going to that job that you hate? Why are you still in this relationship that all you're doing is it brings like resentment in you, but you're holding on to it? So it can be even as simple as I know I shouldn't, I don't like the word should, but this isn't serving me, that this behavior or the kind of content that I'm listening to, every piece of our environment goes in and influences us. Why am I still saying these things? That if I listen to the words that I'm saying, which are spells, I'm owning that. And my body is
mm,
going to make that a reality because I'm telling it. Your body doesn't know nuance and it doesn't know sarcasm.
yes.
It knows exactly what you say. And if you look in the mirror and you say, oh my God, look how ugly this is or how awful this is. Maybe I'm projecting here. I don't know. Or I can never find the right person, or I can never find the right job. Guess what? Your body's believing that. And so,
Yes.
you take these B cells, or you take any of these, but then you go right back into the environment that is causing that stress, or causing those exposure to toxins or the molds or all those other little things that we know that are constantly, challenging our body. You're right. Why,
Yeah.
we keep giving ozone, we can keep giving stem cells, which I love them all because they're fantastic. But they're not going to truly enable you to be who you want to be. And healing implies that something's broken. And I like to encourage the idea that we're not broken,
No.
and we don't need to heal unless we are attached to the idea that we aren't already whole. And that's why I need to find a new relationship for myself with the idea of using words like healing, because then I'm implying to somebody
Mm-hmm.
there's nothing wrong with you. And I would rather imply that there's nothing wrong with you. You just may not be exactly who you want to be yet. So let's
Yeah.
unfeel, or let's get you into that environment that allows that to express itself.
Yeah. It's a return to the authentic self, which is a completely healed and always, optimized individual on every level. And I remember even on the panel, it was a little bit of a, not debate, but the idea thoughts become matter. I remember
Yep.
you are very much a proponent of that. And I do completely agree with you that, your beliefs become your reality. And it's a big part of it. How much of the idea of intention while you're receiving treatments, especially the Biohack Lab with you, how much does that play a role in the overall success of a treatment?
Huge. In
Yeah.
fact, I even give them their stem cells before I infuse them, and I have them imbue their intention into
I
others.
love that. We do the same. I have a little sticky note that we give them that they could put on the bags or any with that I am healing, I am strong. Yeah.
And
Some
so
people laugh at it, but again,
I try
it's
to make them
powerful.
do it. And then after a while, they're like, oh, you know,
Yeah. Yeah.
because they haven't been given permission to say, what do I want? What do I want with these guys? And everything is about, yeah, well, I don't want to say everything is about intention, but it doesn't necessarily have to be verbalized and like, oh, I want just to this. But the intention may just to be open to healing. It may just, or there's that word healing again. um, Open to receiving, actually, would be, even if
Yes.
it, for most people, we have a hard time receiving. And so I do IV ketamine therapies as well. And that is the only way that experience goes, not the only way, but that is what allows that experience to be so impactful, is to be open to possibilities, open to seeing things differently. Um, and the intention can be specific after a while, but the intention is what is innately you, the I, saying, this is who I want to be, this is who I am. And that allows for things to align, go, oh, okay. So it's a big piece.
Yeah. And again, people sort of overlook it. They think, oh, whatever. But I truly believe, and again, through anecdotally seeing people and their healing journeys are much speedier when they have that intention, when they have that why, when they have goals that go beyond, I just don't want to be sick. A lot of times, sometimes even that may be in the subconscious, not really the truth, right?
Mhm.
Subconsciously, a lot of people, I do believe, attach themselves to their disease and lean on that. They've been out of, let's say, the workforce, or and kind of using that. Oh, I'm not going out because I'm sick, guys. I'm not doing this because I'm sick,
Oh, yeah. Oh, that's huge. And
right?
gosh, I've got too many stories, because I see it in the ER all the time.
Mm,
Um, and I think that is what started frustrating me the most, is people not wanting, they owned their sickness. I have this, I have this. And they would come in because it was exacerbated, or they thought it was. And there was no even awareness that, who am I if I don't have this? It's not in their vernacular. It's
mm,
not in their relationships with their family. It's not in their relationship with work. It's not with, I'm like, I'm learning is, what are you willing to give up to get what you want?
mm,
So for the medical or for physiological stuff, particularly if they're younger, kids would hold on to, we were learning that, a headache or stomach ache was a way of, kids with migraines, we learned that, we're learning that one reason maybe kids would get migraines is because that's when they got attention from their family.
Mm,
Maybe the parents were arguing and then Johnny got a headache and all of a sudden they weren't arguing with each other. They're trying to get him better. So that was calmed down and he was getting the attention. It wasn't a purposeful attention. It was kind of like, I have no way that I can get my parents to stop arguing.
yeah.
So my body's like, here's a solution.
Yeah.
I'm gonna give you a headache and I'm going to make them pay attention to you, maybe take you to the hospital, maybe dote on you. And so everyone can be calm now.
Yeah.
And we don't realize these things come up. And you have to be saying, okay, who am I if I'm not, a diabetic or if I'm not, some itis or some chronic thing, because you have to be willing to give up what it's doing for you.
And that's kind of a beauty also of the intelligence of the body. The symptoms are warning bells. The symptoms are signs. Sometimes you need to be a detective to start to, find, well, migraine, could it be the family dynamic? And, that's a protective measure of sorts. But for many people, I think we go into this act of subdue symptoms immediately. Don't question, don't ask. Headache, Advil. That's it. Tylenol, Advil, like anything, pain, just get rid of it. When we should be asking a lot more, what's this trying to tell me, right?
I think I said superpower, and that might be a little bit strong, but I would use words like anxiety or depression and pain. I got to find a better word than superpower right now, but they are in a sense
Yeah.
that they're like these beacons saying, okay, something's off. I'm trying to tell you something. Your body's here like that. And it could be beautiful warning signs, like in an acute setting. They get you out of that state of danger, or they get you out of that behavior. But when we hold on to it, or we subdue it or take it away, like painkillers or anti-anxiety medications, we don't actually get to fully feel it and learn through it and move through it and figure out what it's trying to tell us, because we don't want that feeling. We want to get rid of it right away. And we've got all these modalities and pills and things to get rid of it,
Yeah.
but it doesn't get rid of it. All it does is it stuffs it down because it's going to come back up.
Yep.
And stuff it down again, come back up until we deal with it. And yeah, so symptoms are exactly that. They are telling you, your doctor, something. We're just not listening.
Yeah. And that's why I feel like we need to be much more introspective and much more intuitive with our bodies. I don't feel many people are in touch with that and don't even want to be. I find that interesting sometimes that people don't stop and just ask themselves questions in their head and are almost scared to. We distract ourselves all the time with media, with something else, with Netflix, all these things, when even just like 5 to 10 minutes of asking, how do I feel today? What worked, what didn't? Am I feeling where in my body let me sense it and kind of, sit down, meditate and ask a question on it. That would be so helpful for everyone.
I used to joke, and I still kind of do, is we haven't been taught how to pay attention to our body. In fact, I mean, most of us don't even know when we have to go to the bathroom, like truly,
Sure.
Or when we're hungry versus thirsty, when we're tired versus, thirsty. Could actually, there's just all these things that we have no connection. Like, when am I truly hungry? Or am I just, is this some Pavlovian response? Or am I just nervous? I mean, big categories. Yeah, we can also say what this emotion feel like, but just basics, like we aren't tuning into our body. We're going by the clock. I shouldn't be hungry until this time. Or it's external signals that are telling us how to read our body versus, oh, this is what I'm feeling. At least in this society, I know there's other societies that they're more in tune to some of this, and cultures. From my experience growing up, even though I had kind of hippie parents, but it still wasn't a daily practice of, what am I feeling?
Yeah. And you're right. There are definitely cultures that do it, that slow things down and ask those questions and are incredibly introspective. A lot of Asian cultures, really value that. But it doesn't happen here. And it's one of the reasons I'm a proponent for traveling and seeing that, maybe opening your mind that yes, it's not just like America everywhere. Things are different elsewhere, and you could actually benefit a lot from learning about that. Talking about what's out there in the world, is there anything you're excited about the future of medicine or things that you're eyeing to add into your toolkit?
Oh, geez. We don't have enough time for that. Uh, oh my gosh. So many things. But they all ultimately come back to the why. But there's
Mm,
modalities that I'm still interested in. I'm taking some deeper dives into photobiomodulation and
mm,
turns on certain cells and certain activators things. There's the plasmapheresis that's coming out and all of it's different, whether it's just exchange, whether it's the young blood, whether it's um, it, on top of ozones and lasers and frequency devices. And I, I just love the tools because I think it's fascinating. And
yeah.
I think we're learning more on how to make them work with the body because all of these are tools. And I do get on my little soapbox sometimes when there are places out there that have all the tools, but there's no guidance of when to use them,
Mhm.
how to use them
Right.
for what our goals are, because they can actually be very damaging. Well,
Absolutely.
but eh, definitely not getting you to the goals that you want if used for the wrong reason. And the most common one is a cold plunge. Like
Mhm.
if you do that right after you work out, I'm so sorry, but you just kind of negated some of your potential
Mhm.
gains. Now, if you're an athlete and need to get back on the field and you need quick repair because you got to perform again, yes, do it after the game. So even timing of when a cold plunge might be or cryotherapy or something, and that's a very small example, but it is an idea of what does my body need at this time. I love learning about all these modalities. I'm, even to other consciousness fun things, but
Mhm.
they all come back to how are these going to help me where I am get my body aligned to show up in this 3D reality the way that I want to show up.
Yeah.
And that's the only reason I'm learning all these things. And that's the only reason I'm in this role is to be able to say, here's a cornucopia, but let's see where you are and which one of these fits in your construct and what you might be open to. And of course, I will challenge that construct a lot in a very loving way because I'm always trying to expand the mind. But yeah, so there's a new modality almost every day or every week. And that's the beautiful part of how AI is allowing things to evolve. And um, but I don't want to get away from the fact that these are only tools that
Yes.
help us once we've allowed ourselves to say this is what this physical body needs at this point in time because we're always being exposed to stuff, we're always being bombarded. Um, so that's another segue of answering.
No, it's very, very true that it's an exciting time and there's always something. I too am such a geek about like new modality, learning something new and seeing it applied, and it always gets me going. And I know there's other people out there also, but you still have to approach it with some artistry and some sense of how does it fit into the whole and how does it fit into the individual as well. Because if we just start collecting all these things and then just throwing them randomly at people, you're right. It could actually harm the person in some ways. A lot of these don't have negative side effects, especially if they're more on the frequency and energy side. The body will take what it will, but it's just not going to be that efficient. It's just I already had that information. I don't need it. Thanks, but no thanks. I need this information which you're missing. So there's still such an artistry to medicine, and we can't overlook that. And we can't become technicians that just say, try everything and let me throw it all at your body because it will sometimes be that it's detrimental to you. And at least it'll be for healing or for going through a chronic disease and trying to come out better. It's going to be a long, long time of hit or miss. And this is what you probably see with a lot of patients that come to you. Oh, I've already tried that. But have you tried it in conjecture with this and started here, detox the body,
Well, they
then
don't
done
want
it? And
you're one session there or one session there, one session there, and
yeah,
no, yeah, there's that magic bullet again.
yeah, no, that's what people have to learn. But luckily, there are places like the Biohack Lab that and yourself that are helping people really understand that and apply it in the right way. Where can people learn more about you and the Biohack Lab?
Well, the website is in construction. It doesn't tell you much about me. It mentions a couple modalities, but drsienna.com. It's DRSIENNA. Granted, it doesn't say much yet, but it's a landing page. The Biohack Lab has my information and a lot more of these modalities, and that is literally the biohacklab.com. Those are the biggest platforms right now. Things are growing. It's there's a lot here and there's a lot there. It's just not
Yeah.
social media
Oh,
yet.
trust me, I know. It takes time for it to leave the brain and make its way out into the interwebs and everything else. And it takes time. Listen, I understand you're a practitioner. You need to focus on patients first and helping others. So it's not always easy to do it all.
As my mom would have said and did say when she was around, is her wish for me when I was 17, I think, is not to solve all of life's problems in the next 24 hours.
Yes.
Yes.
Nature is sometimes slow and deliberate. Ask anybody that's pregnant. You know, you're not going to just do it in 3 months,
They
9 months.
say-
Like to Sienna, thank you so much for coming on. I want to come visit next time I'm down there and experience it also. So you'll be hearing from me shortly. And to everyone listening, do go check out drsienna.com, thebiohacklab.com. And until next time, continue writing your own healing story.